is right for you. Infertility treatments that work. It's untrue that simply waiting it out will put an end to infertility. Like other medical conditions, there are treatments available for those experiencing infertility. At least half of couples undergoing infertility treatments will conceive, and technologies such as in vitro fertilization have brought about many pregnancies. Over 3 million babies have been born worldwide due to this technique. Symptoms of infertility. The main symptom of infertility is failure to conceive after a year of unprotected sex. This is the point at which most doctors recommend seeking fertility care. For women over age 35 who did not conceive after 6 months of trying, or who have irregular menstrual cycles, seeing a fertility doctor as soon as possible is recommended. Male infertility is just as common as female infertility, so it's important that both partners be evaluated. Male infertility. Male factors are responsible in about 40% of infertile couples. Male factors can include low sperm count, abnormal sperm appearance, blocked sperm ducts, or poor motility of the sperm. Female infertility. An additional 40% of infertile couples have problems traced to the female partner. These can include irregular or absent ovulation, blockages in the fallopian tubes, or abnormalities in the reproductive organs. In the remaining 20% of infertile couples, no specific cause can be found. Tracking ovulation. Bad timing can contribute to a failure to conceive. Over-the-counter ovulation tests can help you figure out the time of ovulation, egg release, and determine the best time for sex. The tests measure levels of a hormone that increases 12 to 36 hours before ovulation. If the test results are unclear or consistently negative, consult your doctor. About 1/3 of all cases of infertility are related to irregular ovulation. Fertility drugs. Medications are available to help women who do not ovulate regularly. Clomiphene citrate, Clomid or Serafine, is the most common of these medications. It is relatively effective and inexpensive, and about half of women who take it will conceive, usually within 3 cycles. Clomiphene may cause the release of more than one egg at a time, so there is an increased risk of a multiple pregnancy, a pregnancy of 2 or more fetuses. Injectable hormones. After trying clomiphene for 6 months, women who have not conceived may be prescribed injections of hormones to stimulate ovulation. A number of different hormonal preparations are available. As with clomiphene, the chances of a multiple pregnancy are increased with hormone injections. Surgery for blocked fallopian blockage or scarring of the fallopian tubes prevents pregnancy in some women. This may be due to endometriosis, overgrowth of uterine lining tissue outside the uterus, previous surgeries, or damage as a result of previous pelvic infections. Laparoscopic surgery can remove scar tissue in some women, increasing the chances for pregnancy. Intrauterine insemination, IUI. Intrauterine insemination, IUI, is used to treat different kinds of infertility. In this technique, sperm is placed directly into the uterus at the time of ovulation, reducing the distance the sperm must travel to reach the egg. IUI is often used together with drugs to stimulate ovulation. Pregnancy rates are lower than with IVF, but this procedure is less expensive and less invasive, so it may be attempted first. IUI with donor sperm. IUI can also be performed using sperm from a donor, if the male partner has a low number of healthy sperm. Counseling is typically recommended prior to this choice since the child will be biologically unrelated to the father. IUI with donor sperm is very successful in fertile women, with a cumulative pregnancy rate of over 80%. In vitro fertilization, IVF. IVF combines the egg and sperm in a laboratory, and can be an option when other treatments have failed. Embryos created in the lab are placed inside the uterus. IVF involves hormone injections and a surgical procedure to retrieve eggs from the female partner, and it can be costly. However, success rates are improving. Pregnancy rates per cycle range from 10% in women aged 43 to 44 to 46% in women under 35. Several cycles of treatment may be necessary. IVF with OBGyn. When problems have been identified with a man's sperm, a procedure called intracytoplasmic sperm injection, OBGyn, may be recommended along with IVF. This is a laboratory-assisted fertilization that involves inserting a single sperm directly into an egg. The embryos that form are transferred to the uterus in the same way as IVF embryos. Most IVF cycles now also use OBGyn. IVF with donor eggs. Women who have poorer egg quality, are older, or who have not had success with previous IVF cycles, may choose to consider IVF with donor eggs and her partner's sperm. The resulting baby is biologically related to the father, and not the mother, although the mother carries the pren.